so we're respectful for everybody's time. Thank you guys so much for being here. This is the Direct Care Resilience Project, and we are really excited to have you here. The purpose of this project is to expand agencies' leadership's capacity to support employee mental health. We're hoping to build direct care professionals' resilience skills by increasing awareness of mental health self-care. And we have various target audiences for this project. This one here is our second implementation, and we really tailored it towards nursing homes, assisted living care facilities, and any of those direct frontline workers, as well as organizational leadership. So we kind of have a broad definition of direct care professionals. Those are basically any frontline employees who provide direct care to clients or patients to be healthy and live in safe environments. We're also hoping to provide you guys with resources to help sustain and strengthen the current workforce to limit staff turnover. So before we begin, we want to kind of describe what sets ECHO sessions apart from other webinars and trainings. In essence, ECHO allows us to move information and not people. It allows you to actively learn about a topic and become a resource for your community. Each session, there's going to be a formal didactic portion on a designated topic. You can find the upcoming topics within the iECHO or on our website. Some of the sessions are geared towards the direct care professionals, but also for you guys as well, just on building personal resilience skills. We also have some sessions that are tailored for supervisors. So supervisors get some of that training on how to support their employees that may be dealing with compassion fatigue and burnout, and just helping you build capacity and how to support those situations as they come up. But we also have some sessions that are tailored towards organizations as a whole. So any leadership people would be great to join those ones. So how do you incorporate mental health practices into organizations' culture and into your policies and practices? So most of our sessions, didactic portions, are focused on those topics. And then we have a case presentation where you, the participants, can actually provide a real life case scenario and get feedback and resources from our content specialists and other participants. This is an excellent opportunity for you to learn about additional resources and ways to assist your employees, and which will then affect the people that you work with every single day, like your patients and residents. We encourage you to take part in the case presentations during our group discussions. Feel free to unmute yourself or raise your hand if you're comfortable speaking up. Otherwise, you can just put some input into the chat and we'll make sure that that information gets shared with the group. Your participation is key to the success of these sessions. We really want to create an interactive community where everyone can be supported during each session. So we encourage you to turn on your camera as long as you're comfortable. And we appreciate when you're engaged in asking questions after the didactic and provide feedback for the case. These case narratives are the best way to solidify skills learned in the didactics and receive direct advice. So feel free to upload your questions and we will address them at the end of the presentations. We do offer social work and nursing contact hours for these sessions. We just ask that you fill out the evaluation form that will be sent out at the end. And trust me, we all know that nobody likes to fill out evaluation forms, but it is incredibly important for the success of our project. We do take all of your input very seriously, and we will change future sessions based on your commentary. And it's also really great for our funders to showcase the work that we're doing and showing that their money was put to good use. So we really appreciate whenever you guys fill out those evaluations. So we'll go ahead and get started with introductions. Jessica, do you want to go ahead and unmute and introduce yourself?
Sure. I'm Jessica Reiswig. I'm one of the project coordinators on the Direct Care Resilience Project. I'm really excited to be here. We wrapped up a really great resiliency series for DSPs working with people with disabilities, and we're so excited to expand and focus on the aging community. So thanks for coming.
Go ahead, Kyle.
Yep, I'm Kyle Erickson. I'm the evaluator here for ECHO. So I'm the one in charge of the organizing and collecting all those wonderful surveys that all of you are gonna take after this, right?
Thanks, Kyle. And we also have Jody Patchett on our team. She serves as a project assistant, so she can help with any technical assistance that you may have going forward with these sessions. And I'm Krista Opsedal. I'm the Project Echo Director here at the North Dakota Center for Persons with Disabilities at Minot State. And I'm actually going to be your speaker for today. So today we're going to talk about an introduction to resilience for compassion, fatigue, and burnout. Prior to my role at NDCPD in this capacity, I worked for a disability organization. I was a direct support professional for 4 years, and then I also was a coordinator of assistive technology, so did a lot of consulting work and innovative solutions to help people live independently and work independently. And recently, I became a caregiver for my aging grandma, so we provide in-home supports for her. And this series has been incredibly beneficial for me personally as I move on to that different capacity in my life. So today's objectives, we're hoping that we'll be able to differentiate between compassion fatigue, burnout, and stress. We're going to identify tools for resilient care providers. And then we're also going to identify traits of resilient organizations. To get us started, as many of us know, since the start of the pandemic, many employees have been faced with persistent and indefinite stressors, which has led to compassion fatigue, burnout, secondary traumatic stress, or vicarious traumatization. This survey was taken among human service employees, first responders, and those in education services. And why is this important? Well, in 2021, the American Psychological Association did a work and well-being survey of adult workers, and 79% had experienced adult or work-related stress in the month before the survey. Nearly 3 in 5 employees reported having negative impacts of work-related stress, which includes these statistics that you see here. The one that really stood out to me was the 44% reporting physical fatigue, which was a 38% increase since 2019. This results in decreased productivity, and it has resulted in about $500 billion lost for employers in lost productivity. So this also may look like an increased use of sick days, job dissatisfaction, increased errors with our line of work is really not great because we're in charge of people's quality of life and care. So medication errors can have a really bad impact on the people that we're working with. And in worst case scenarios, some people may just choose to leave the profession entirely. Also, if workplace stress goes left unchecked, it can lead to chronic diseases, injuries, and then, like I said, cost employers $500 billion in lost productivity each year. Now that we got through the really fun facts of this presentation, let's go ahead and talk about what we actually came here to learn about today. Compassion fatigue and burnout. And I like to start with these definitions because I think burnout is often overgeneralized just to talk about exhaustion and fatigue in the workplace. But the real definition of burnout is a prolonged response to chronic emotional and interpersonal stressors on the job that leads to a combination of physical and emotional exhaustion. This can lead to a development of a negative job attitude, negative self-concept, and loss of feelings of concern for people. So this is important to recognize because burnout is kind of like the last straw of things, and it's really hard to mitigate once people are actually into that phase of burnout, whereas compassion fatigue is more a state of emotional distress and exhaustion, which results in the decreased ability to cope with the everyday environment. People may have a reduced ability to empathize or feel compassion for others. And there's several factors that indicate how vulnerable somebody is to compassion fatigue. The first is a combination of empathy and a lack of boundaries. When I first heard that, I was like, thank you. I see myself in this, and that's not somewhere where I wanted to see myself, but it is what it is. So we really want to understand the difference, because if somebody's feeling that compassion fatigue, there is hope that we can do some interventions and help that person get back to center and not go into that burnout phase and possibly leave their jobs or the profession entirely. As we mentioned with Echoes, we like to do a case presentation. We're going to do it a little bit different today, and we're going to start it now. I really like this case. I actually found it in the literature, and I thought that it was a pretty generalizable one and a case that we've all seen before. So Cynthia is a nurse who works in a 350-bed hospital. She's been a nurse for 7 years. Her typical assignment is 6 to 7 patients, and she's currently working her 6th 12-hour shift because several staff are on leave. In her private life, she also cares for her aging father, and she raises 2 grandchildren. There was 2 events 3 weeks ago, and since then she's finding herself having trouble sleeping. She feels exhausted and sad. She has flashbacks to the events, and she's caught 2 possible medication errors at the last minute. Both of these events involve patients who she was really fond of, who had deteriorated, and she thinks that she should have called the rapid response team, but unfortunately the patients died beforehand. And no amount of reassurance from her managers or colleagues have helped her relieve her guilt. And she often finds herself avoiding contact with suffering patients, and then no longer refers to them by name, but instead their diagnosis. So using the chat, what do you guys think Cynthia is exhibiting signs of? Do you think this is burnout, or is this compassion fatigue? And what makes you think that that's the case? We'll give you all a minute or two to put that into the chat. And we're talking specifically about burnout and compassion fatigue in this presentation. Thank you, Christine and Jessica. Yep, both are leaning towards compassion fatigue. So what are the signs and symptoms of compassion fatigue? When we were putting together this presentation, one of the research articles that I had read kind of combined a list of physical, emotional, mental, spiritual, and workplace performance symptoms that may be part of compassion fatigue. And taking a look at this, is there any symptoms here that kind of stand out to you that maybe you didn't think was compassion fatigue or was related to it? Feel free to unmute or put your thoughts in the chat. I remember being really surprised by a lot of the physical symptoms. When I've been in jobs where I was really stressed out, I had a lot of stomach pains, and I guess I never attributed that to anything beyond just poor diet, which I'm sure was a part of it, but I was very surprised at how much gastrointestinal or stomach pains are linked to stress and anxiety and possibly compassion fatigue. Yeah, Elizabeth, I agree. She says that it's sobering to see the physical symptoms. Another one that stood out to me was Boyle's definition with the emotional and mental cynicism. I guess I've seen that too, where I've worked for agencies where there was just like this collective cynicism amongst employees. It seemed like no matter what leadership did for various like wellness initiatives, like there was just this overall sense of like nothing matters anymore. And I wonder now if that was linked to compassion fatigue, if there was some more stuff going on the ground that people weren't recognizing at the time. So I remember, or I just think that there's something there that's really interesting. So I want to show you guys this really great video. I love neuroscience and understanding like what's actually happening with the body when we're experiencing this. So this is a great video on what stress does to the brain. Can you guys hear that okay?
Are you sleeping restlessly, feeling irritable or moody, forgetting little things, and feeling overwhelmed and isolated? Don't worry, we've all been there. You're probably just stressed out. Stress isn't always a bad thing. It can be handy for a burst of extra energy and focus, like when you're playing a competitive sport or have to speak in public. But when it's continuous, the kind most of us face day in and day out, it actually begins to change your brain. Chronic stress, like being overworked or having arguments at home, can affect brain size, its structure, and how it functions, right down to the level of your genes. Stress begins with something called the hypothalamus pituitary adrenal axis, a series of interactions between endocrine glands in the brain and on the kidney, which controls your body's reaction to stress. When your brain detects a stressful situation, your HPA axis is instantly activated and releases a hormone called cortisol, which primes your body for instant action. But high levels of cortisol over long periods of time wreak havoc on your brain. For example, chronic stress increases the activity level and number of neural connections in the amygdala, your brain's fear center. And as levels of cortisol rise, electric signals in your hippocampus, the part of the brain associated with learning, memories, and stress control, deteriorate. The hippocampus also inhibits the activity of the HPA axis, so when it weakens, so does your ability to control your stress. That's not all, though. Cortisol can literally cause your brain to shrink in size. Too much of it results in the loss of synaptic connections between neurons and the shrinking of your prefrontal cortex, the part of your brain that regulates behaviors like concentration, decision-making, judgment, and social interaction. It also leads to fewer new brain cells being made in the hippocampus. This means chronic stress might make it harder for you to learn and remember things, and also set the stage for more serious mental problems like depression and eventually Alzheimer's disease. The effects of stress may filter right down to your brain's DNA. An experiment showed that the amount of nurturing a mother rat provides its newborn baby plays a part in determining how that baby responds to stress later in life. The pups of nurturing moms turned out less sensitive to stress because their brains developed more cortisol receptors, which stick to cortisol and dampen the stress response. The pups of negligent moms had the opposite outcome, and so became more sensitive to stress throughout life. These are considered epigenetic changes, meaning that they affect which genes are expressed without directly changing the genetic code. And these changes can be reversed if the moms are swapped. But there's a surprising result. The epigenetic changes caused by one single mother rat were passed down to many generations of rats after her. In other words, the results of these actions were inheritable. It's not all bad news, though. There are many ways to reverse what cortisol does to your stressed brain. The most powerful weapons are exercise and meditation, which involves breathing deeply and being aware and focused on your surroundings. Both of these activities decrease your stress and increase the size of the hippocampus, thereby improving your memory. So don't feel defeated by the pressures of daily life. Get in control of your stress before it takes control of you.
I love that the video ends on a happy note, because there's a lot of times where I'm like learning about stress and then all of a sudden I become very stressed. So I'm excited that it ends on a happy note, and we're going to kind of dive into that a little bit more. So we really want to get ourselves to a place of compassion satisfaction. We need to recognize the signs and symptoms of compassion fatigue, but then we also need to figure out how to get us back into this positive state of feeling happy and at ease in your role as a helping profession. We want you to be able to believe in yourself and your abilities, feel connected to others, have a good balance between work and free time, and just feeling satisfied with those that you're working with. And the number one technique for getting to that compassion satisfaction is self-care. And when I first started working on this series, I had a pretty broad or vague definition of what self-care was. I kind of assumed that it was just like meditation, yoga, taking a bath, but it is a lot more than that. Those can be components within it, but it is a bigger, broader concept. It is the ability to refill and refuel oneself in healthy ways, including engagement and behaviors that maintain and promote physical and emotional well-being, that lessen the amount of stress, anxiety, or emotional reaction experienced when working with clients. There is a medical definition of self-care, which is a lot about taking care of yourself to manage chronic illness and diseases. But I prefer kind of the social model of self-care. And one thing that I find very interesting is within the nursing code of ethics, there is actually a clause in there that says that it is the nurse's duty to ensure that they are taking care of themselves so they can provide the best quality care for their patients. And I think that that's really fantastic. I'm from the disability field, so the direct support professionals that I work with, they don't necessarily, we have one code of ethics that's from the National Alliance of DSPs, but within their code of ethics, it's all about providing quality care. There's nothing in there about taking care of yourself. Well, we all know that if you're not taking care of yourself and if you're not well, you're not going to be able to provide well for others. So I really like that the nurse code of ethics kind of sets that precedent that it's okay to take care of yourself. And I really like the 8 dimensions of wellness model by SAMHSA. I like how they define wellness. They define it as how we live our lives and the joy and fulfillment and health that we experience. This model really focuses on creating balance, embracing support from others, and valuing routines and habits. So whenever we're going through a rough time, whether it's stress, illness, trauma, whatever it may be, balance is really important. In these times, our habits and routines can help us get back to normal and get that feeling of sense of control back. I know personally, whenever I'm really, really stressed out, I've learned through meditation and just being mindful that usually I'm kind of grasping at straws, trying to find control. So I really appreciate how the 8 dimensions of wellness kind of looks holistically at health. And so you can kind of identify which dimension are you feeling most stressed out in, and how can we kind of recenter ourselves so that we feel like we're back in balance. So this might be focusing on the roles that we play in our lives, whether that's a student, a friend, a parent, spouse, coworker, looking at all of that and figuring out, okay, where am I actually feeling stressed out? This model also gives a lot of really great tidbits. So being active in activities that have purpose. So if our daily routine lacks meaning, we might be feeling distressed or powerless. We want to make sure that we're increasing activities that contribute to our wellness. So this might look like talking to a friend at the start of our day. One of my favorite things about work when I was working in the office was my little conversations that I had with my colleagues right away in the mornings. You know, how was your weekend? What are you doing? What are you working on currently? And it just kind of helps you recenter and figure out what you're going to tackle that day and set an intention and a plan. We do have a session dedicated just to this concept, and it is on August 16th. So if you're wanting to explore this a little bit further, we do have a really nice interactive session on how to do this personally, but then also how this has been incorporated in an actual organization here at Minot State University. Some additional compassion satisfaction techniques. You can start with taking a self-assessment. The professional quality of life assessment was developed by a psychologist, and it really helps figure out if you are feeling stressed in your job. I've done some of these before when I thought I was doing really well, and I was shocked at it popping back and saying, no, you're actually pretty stressed out. And then I was able to take a step back and kind of self-reflect and kind of pinpoint where these feelings were coming from for me to answer that assessment in that way. And it boiled down to, I wasn't feeling confident in what I was doing. I had that classic imposter syndrome that was going on at the time. But if I hadn't taken that assessment, who knows if I would have actually done anything to get myself back to feeling, you know, like I was competent in what I was doing. Another technique is to make self-care a routine. Try to make it a habit. Maybe you need to schedule time for yourself if you are super busy. Jessica and I, we actually go on circ walks, usually around 11 o'clock every day or 10:30, and try to text each other, because there's many days where I just want to skip it. But if I get a text from her, I'm like, okay, fine, I'm going to go too. So find a buddy and try to get this scheduled and making it into a habit. Also, we need to review our beliefs about self-care. Self-care is different from selfish acts. We want to engage in activities like games, watching funny movies, just doing whatever you need to do to refill your cup. There's plenty of times where I've been in like big social situations and I have a lot of fun. I feel like I'm very extroverted, but at the time or at the end of it, I'm just drained. So I just have to flat out say to my husband, I'm watching my favorite show and I don't want to be bothered. Just give me this hour to myself so I can just refill, and just recognizing that that's not a selfish thing to do. And finally, having compassion, community compassion. Really celebrate your accomplishments and those of others. Try to uplift those people that you work with and what they're doing, because it's definitely a team approach. So we've kind of talked about some of the personal things that you can do to help with compassion satisfaction, but it does take a village. And any leadership people that are in this session today, it's really important to take a look at the workplace factors that can lead to burnout. So the Mayo Clinic has identified some of these as the most common ones. The first one being a lack of control. This is an inability to influence decisions that affects one's job. Unclear job expectations happens when an employee is unclear about the degree of their authority or what their supervisor's expectations are of them. Dysfunctional workplace dynamics. Employees can feel undermined by colleagues or micromanaged by their superior, which can lead to job burnout. Extremes of activity. If a job is really monotonous and it's the same thing every day, or vice versa, if it's super chaotic and requires constant energy to remain focused, all of these can lead to fatigue and eventually burnout if left unchecked. A lack of social support, which is feeling isolated at work or in one's personal life, that can make people feel more stressed if they don't feel like they have someone that they can go and vent to or get advice from. And finally, work-life imbalance. If a job takes up too much time and effort and that employee doesn't have energy to spend time with family or friends or doing whatever they prefer to do, that's a recipe for burnout as well. So it's really important for leadership to assess if any of these factors are happening within your organizations and figure out ways that we can address these issues. There was a study of trauma nurses where the authors had made these program recommendations to help increase employee wellness, especially if you're seeing some of the burnout factors that we had just talked about in the previous slide. And number one is my absolute favorite. It's just acknowledging and accepting that compassion fatigue is an expected reality of this job. I personally felt compassion fatigue before, and I felt very guilty for feeling compassion fatigue. And I felt like I was a terrible person and that I wasn't doing well at my job at that point. So if supervisors and leadership are able to just set that precedent that this is a hard line of work and you're gonna eventually feel this, and that's okay. We can help you work through this and come at it with a team effort. Number two would be to educate the team on how to recognize the signs and symptoms. So possibly using that survey that we had talked about, the professional quality of life survey that is included in a slide a few slides ago. Leaders can also employ stress coping skills as a team, because positive coworker relationships can alleviate compassion fatigue. Leaders should be demonstrating social support, which is strongly associated with job satisfaction. This can be done through casual check-ins with your employees. So just pulling in someone into the office for a 10-minute conversation with like, how are you doing? How are you coping? Is there anything I can help you with? Number five is to normalize discussions on coping as part of regularly scheduled meetings, not just in response to crisis. So if you have regularly scheduled staff meetings, maybe have a little portion where we're talking about how is everybody coping? Is there anything that we can do to help you if needed, if you don't feel like you have the resources available to you? Number six is to be proactive in high crisis situations. So making a counselor available or holding critical incident debriefings if something intense such as a death or abuse were to happen. And finally, emphasize the positive aspects of patient care and celebrate those positive patient encounters. Some other strategies that might be helpful is rotating care of difficult patients, not just having that one nurse assigned to them, and pairing novice nurses with experienced ones for coaching and mentoring. Some other complementary approaches might be making sure that there is a designated break room where people can go and just rest while they're on shift. Some organizations have gone as far as like putting in a massage chair, aromatherapy areas for just quiet time with quiet music. Each organization is different whether that would work for them or not. But it is good to kind of just take a look at your break room. Is it actually a relaxing place that people want to hang out, or is it plastered with passive aggressive signs about keeping the microwave clean? I have worked for agencies where there was probably 7 signs posted throughout the break room about cleanliness. And I was like, are you serious? Like, I'm just going to go eat my desk like a sad person, I guess. So I do want to share this with you guys. The US Surgeon General released this really amazing framework for supporting mental health and well-being in the workplace. This was released about a year or so ago, and they created 5 essentials for workplace mental health and well-being. Each essential is anchored in 2 human needs, and it's all centered around worker voice and equity. So as we had talked about, at the beginning of this, chronic disease and illnesses cost $500 billion in lost productivity each year. So the Surgeon General leaned into decades of research that showed that prioritizing investing efforts that address workplace wellness can have really significant returns on investment and organizational costs. This might look like reductions in absenteeism and annual healthcare claims. And also organizations that focus on worker well-being have reported higher productivity and retention rates. So we're going to kind of dive into this. It's going to be kind of a fast and quick overview of what all of this has to offer. And we do have some sessions that are tailored towards these different essentials where we go a lot more in depth into these concepts. So the first essential is protection from harm. And this is anchored in safety and security. The first component is to prioritize physical and psychological health and safety. This component encourages leaders to collaborate with workers to examine and eliminate workplace hazards and design and evaluate programs for workplace safety. Some of these programs or efforts can look like assessing if employees feel comfortable speaking up without fear of retaliation or being punished or humiliated against. This one's really hard to do because it takes a lot of self-reflection and honesty. So maybe starting with yourself, like if I'm a supervisor and somebody comes to me with an issue, hi, Ashley's husband or friend. You're the only person that I can see, so that was really funny. So yeah, starting with yourself, like, do employees feel comfortable coming up to me if they need help? And then looking at the workplace as a whole, is there programs where people are afraid to do that? And what can we do to help get those supervisors comfortable to receiving those constructive criticisms and feedback? Supervisors can also increase access to workplace training and job tools in multiple languages. Our field has a very diverse workforce, and some people might have English as a second language. So there's many resources available to help put trainings in multiple languages if needed. Supervisors can also examine workload and the adequacy of resources to meet job demands. So do we have enough staffing and coverage? Is there additional things that we could provide to make these jobs easier? We can try to reduce long working hours. I know that is easier said than done, especially if I don't know how your guys' programs work, but I worked in programs where people are allowed to pick up as many hours as they want. And sometimes you just have to put a stop to it, because if they're working, 90+ hours in a pay period, like, they may not be providing the best quality care because they're probably really tired. And eliminate policies and productivity metrics that might cause harm, such as limiting worker rest or bathroom breaks. I feel like that component was kind of targeted towards Amazon, because I'm sure many of you have heard about Amazon making employees pee in bottles, honestly. So don't take them as the prime example of how to support employee wellness. So another component within this is normalizing and supporting mental health. We really want to decrease the stigma of talking about mental health at work. It's okay to validate challenges and communicate mental health as being a priority, and offering both support and prevention services. And finally, operationalizing diversity, equity, and inclusion programs and policies. This does take a little bit of subject matter expertise. So we have a session next week on DEI initiatives. So I highly encourage you to attend that session. I'm really excited for that presenter. And one thing that I really like about this framework is they provide a lot of additional resources under each essential. We will make sure that you guys have access to a copy of this. And here's some of the ones that stuck out the most to me, but please know that there are other resources that you can check out. Moving on to the second essential within this framework is community and connection. The first component of community and connection is rooted in social support and belonging. Organizations can build social connections and community at work by promoting positive social relationships through welcoming, helping, and reassuring others. We also want to be able to cultivate trusting relationships. We as leaders can create structures and opportunities for employees to better understand one another as a whole, which helps employees value and empathize with one another. And having these supportive relationships can improve work performance, worker engagement, and innovation. And there is a little bit of vulnerability that comes along with this. One thing that I've really enjoyed with my current job is I've been comfortable being open about some of my mental health diagnoses. I do have OCD, and it tends to, I like to pick my hair, and everybody kind of knows that about me. But I have had coworkers that have seen when I'm like doing the OCD, like I'm very nervous, I'm not doing well, picking, and just pop in to check on me like, hey, I see you're doing your thing, is everything okay? So really creating those trusting relationships that people can lean into one another is really valuable and can help with retention. Finally, the third component is to foster collaboration and teamwork. So the future of work, whether we like it or not, includes hybrid and remote work. Not every position is going to be able to have that. Unfortunately, with direct care work, we need a lot of people on the front lines. However, some leaders can maybe look at some of the positions that might benefit from a hybrid schedule. So if you have like a case manager who has a lot of paperwork piling up, be intentional about maybe providing that as an accommodation to work from home, like once or twice a month, to catch up on all that paperwork, distraction free, if that person would benefit from it. If you are going to pursue something like this, we really need to be intentional about how teams are going to communicate and collaborate, and model authenticity when they're doing these types of initiatives. Here's some more resources for fostering collaboration and teamwork that you guys can check out after this presentation. We will make sure that you have a copy of the slide deck. The third essential is work-life harmony components. Research has shown that organizations that increase worker autonomy, or how much control employee has over the work that they do, and provides flexibility, they see workers that are most likely to succeed and retain their staff for a lot longer. Some ways to increase autonomy in nursing: if you have some of those employees that have expertise, like a combination of knowledge and extensive experience, let them be able to communicate and organize their work so that they can actually have freedom to act on some decisions using sound clinical judgment. So just trust that they're going to be able to do that, and make it very clear what decisions they're able to make. You can ask for employee contributions to patient care plans. So if you have some direct workers that work really well with certain patients, ask for their input on how do we best support this person, so that it can be replicated with other staff. Also, provide constructive feedback if inappropriate actions are taken, but not necessarily just taking away that autonomy. I've seen it so many times where one mistake is made and then all of a sudden the whole organization has to follow this new policy because of one mistake that somebody made. Instead, provide constructive feedback and try to get that person back on track before making these really big decisions. And then if the performance issues don't pan out, then you can look at, more disciplinary measures if needed, but not necessarily punishing every person that's in that role throughout the organization. And finally, we want to create an environment that supports both formal and informal continuing education opportunities. Some more resources. The fourth essential for employee wellness at work is mattering at work. And this is anchored in dignity and meaning. Dignity is a sense of respect, of being respected and valued. If dignity is affirmed and supported in the workplace, it really enhances well-being. But on the flip side, if people feel disrespected or not valued, they're going to be a lot more stressed out. They might be having feelings of anger, cynicism, and hostility, and might even withdraw from their work. So we really want to provide people a living wage so that they're not stressed out. As we saw in the 8 dimensions of wellness, finances is a big piece of wellness. If you're stressed out about finances, it can leak over into your social life. It can leak over into your work life, where you're starting to feel a little bit more angry or bitter about pay. So try to provide your workers a living wage. We also want to build a culture of gratitude and recognition. Supervisors hold a really powerful role in shaping organizational culture and well-being. Regardless of your position, if people feel appreciated and recognized by their supervisors, their sense of meaning increases, as well as their capacity to manage stress. And this doesn't have to be like a big show of showing appreciation. This can be just one-on-one specific, hey, you did really great taking care of this patient. I really appreciated how you went above and beyond to make sure that they were comfortable, that they got their meds on time. Make sure that it's specific. Don't just say thank you for everything that you do. Anytime I've heard a generalized thank you for everything that you do, I'm like, okay, you don't know what I do. So make sure that you're being specific when you're providing that praise. We also want to connect our employees with the mission of the organization. Missions are so important because they provide a shared purpose and everyone kind of working towards a common goal that makes the work really meaningful. It generates pride and it fuels motivation, which all can help reduce stress. So leaders can reinforce these connections to the agency mission by acknowledging the different roles that each individual team and department has in achieving those organizational goals. And I know the topic of living wages can be really difficult. So there's an awesome tool for conducting a pay analysis within your organization. I encourage you to check that out. And finally, the last component, last but not least, because we see that it's a really nice loopy thing, is having an opportunity for growth. And this is anchored in learning and feelings of accomplishment. So we really want to offer quality training, education, and mentoring. We want to increase skills to help people within their jobs, but also within their area of interest. This might look like rotating through different departments just to see how other parts of the organization works. This could be offering employees different types of responsibilities or assignments that gives them an opportunity to stretch their skills and learn new ones. But it's also critical that we're ensuring that equitable and fair distribution of opportunities are offered to everybody. There's plenty of research that shows that there's been barriers for advancement among workers of color and the BIPOC community. So make sure that you're offering new training opportunities to everyone, not just certain performers. And we want to make sure that we're providing reciprocal feedback. Organizations can create more opportunities for engaging with their workers that is positive and collaborative. So this might include equipping new leaders and supervisors and mid-level managers with support, training, and tools that they need to engage and manage their employees, because the supervisors are going to be that frontline defense for whenever employees are starting to show signs and symptoms of compassion fatigue and burnout. They're going to be the first ones to intervene and help out those employees. So making sure that they're equipped to help them is really important. So like I said, with this series, we do have some additional sessions that are geared directly towards supervisor satisfaction or supervisor training and how to help with interventions. And that kind of wraps up our whole Surgeon General's framework. I really want to draw attention to this resource that's at the end of that chapter, what frontline employees want and what employers think that they want. I had clicked through this and there was a lot of assumptions that I thought and I was wrong about. So it was really eye-opening to me. So if you're going to check out any of these resources, I would start here actually, because I was very surprised by it. Now we'll kind of open it up for questions. If you want to add any questions into the chat or unmute, we can go ahead and try to answer those to the best of our ability. I'm going to play a little bit of music just to give people time to type if needed. And if we don't have questions, that is more than fine. Yes, Diane, this will be recorded. For this session, we will offer CEUs if people fill out the evaluation forms, because the whole session was recorded. But future sessions, we don't record case presentations if it is an actual real person that we're talking about at the end. So if you are wanting CEUs for those sessions, you have to attend in person, but we will provide the recording for later viewing. Thank you, Michelle. I appreciate that comment. I know that was a really fast overview of all of that. Since this was an introduction, we kind of just wanted to showcase what this whole series may be about. So please feel free to check out the website and iEcho for the upcoming sessions. We have the first 6 sessions scheduled out, but we'll add more as we continue, because we're going to have 13 sessions total, I believe. And you can pick and choose which ones. Yes, Elizabeth, this can be distributed to anybody. Anybody's welcome to join these sessions. The more the merrier. So on behalf of our team, we really want to thank you in joining us. Your presence has been really meaningful and impactful. By acknowledging the symptoms and signs of compassion fatigue, we really empower ourselves to better care for ourselves and others. And remember that compassion fatigue is not a sign of weakness. Rather, it's a natural response to the emotional demands of caring for others in challenging situations. By fostering a culture of support and understanding, we can really destigmatize this phenomenon and build resilience within our communities. We hope to see you at our next session, which is going to feature Dr. Lydia Ocasio-Stoutenberg from Penn State University. and she is going to talk about how to create an inclusive and welcoming workplace, diversity, equity, and inclusion. So please fill out the evaluation surveys. Kyle, if you can add a link to that in. Yes, Elizabeth, we have 6 sessions. We have weekly sessions scheduled from now until October 18th. So you can kind of pick and choose which ones you think would be most relevant for you. There is like an overview of what the sessions are about and session objectives, so that can help you with your decision making. And like I said, every session is recorded. Just future sessions might be a lot shorter than this one because we won't be recording any case presentations. So there's probably going to be about 13 sessions in total. We're doing this series a little bit different than our first implementation. Our first implementation had 6 sessions just for leadership and mid-level supervisors, and then we had 6 sessions just for the direct care workforce. But this one we decided to combine them all just to see how that ran. And Kyle just put the evaluation in the chat, so if you could please take that, our funders will greatly appreciate it, as well as us, because we will, like I said, take all of your input into consideration and make changes to our content based off of what you say. So thank you guys so much for being here. We really appreciate it.